We're very honored to be here. We're not nearly as well credentialed in the firearm injury research as the other speakers are today. Our group, which is the Cochrane Collaboration College for Policy at George Mason University, comes at these issues usually from a health perspective, and in today's case, a cost perspective as well. And so today, what we're looking at is a 30,000-foot view of adolescent firearm injuries and costs over the past decade. Basically, before I go into the slides that are rather generic, we don't drill down too far given that it is in fact 8 minutes. We find relative stability in the numbers of injuries, the numbers of deaths of young people between the ages of 13 and 19. And we find very high costs for their medical care. These costs are conservative compared to other types of costs for injuries for this age group, but we find in terms of a reference point that we're spending 3 times as much for hospital care for children who are victims of firearm injuries than our combined federal budget for juvenile justice and delinquency prevention. So some interesting large picture numbers, and we'll move ahead with our overview. And I can't see the screen from here, and I don't have my glasses, but we'll do our best. Today's study is covering kids who are between the ages of 13 and 19. We're including firearm injuries and firearm deaths. The data that we look at come from nationally representative samples from emergency departments, primarily, and then secondarily from the National Vital Statistics programs for the fatalities. The spending money comes from hospital-reported spending for firearm injuries, and we're on the early stages of this project. We're getting the individual patient records that are private and not publicly available to further examine disparities and different processes in the treatment for young people who've been victims of firearms injuries. So first of all, I'm going to go through the numbers of firearm injuries for youth between the ages of 13 and 19. I'm going to cover the medical care and costs, and we'll leave it at the end of the time with a couple of reference points as benchmarkers for spending. We've all seen maps like that. I can't prevent myself from putting in a map, but basically you see the red zones being our high rate, highest quartile homicide and firearm injury rates for youth between 13 and 19. And you can see, as we already know, that it's not randomly scattered, but rather concentrated. And further, it's driven by very small geographic areas within these states. I won't spend a lot of time on this slide, but what you can see is whatever color you see is pretty much where we have the highest quartile of firearm injuries and fatalities for youth between 13 and 19. Did I miss one? Yeah, well, I think I missed one. Between this slide, I had another slide that showed you that though I am including both firearm fatalities and injuries alike, the bulk of all of these are violence related. So if you're worried that the self-harm data are driving these analyses, you don't need to be necessarily, although there are different trajectories between 98 and 99% in a given year are from violence related events. Here we see in a very poor slide the average rate of firearm injuries and deaths per 13 to 19-year-olds per 100,000 13 and 19-year-olds. These are age adjusted, but if we look at it, I don't know if I'm missing slides here. They're not in order. See, this is the one I wanted. All right, so those are the distributions. And then here we can see the rates over the last decade. And what we see is that the rates for these injuries and the deaths being the lower blue line and the injuries being the higher red line, that they have been relatively stable, and they've been picking up in the latter part of the past decade. So what we enjoyed was a small dip in the injuries in the early 2000s and an uptick in the latter years. I will Okay, so we can look at this in case you're worried that that they are in fact statistically significantly different from one another per year. You can see that there's great overlap in the confidence intervals on the injury side. So we know that there really hasn't been a significant change in the numbers of injuries. And now we move on to how do we treat these kids when they come to us with a firearm injury. Hopefully they're not coming to you, but rather going to hospitals. And this data comes from emergency department admissions and includes all of the dispositions for each firearm injury case that comes to their doors. Now, I don't expect you to be able to see much from this slide, but the numbers at the top, the lines at the top show you that the bulk of kids who enter into an emergency department are either treated and released for a firearm injury or hospitalized. So we have two general conditions, treated and released and hospitalized. So the bulk of them are getting hospitalized. The middle orange line is the deaths. So these are the young people who have died. And then at the bottom level, and I can have a hard time seeing it, these are usually kids who have been transferred and their outcome is unknown to that hospital. I took deaths out here just so you can see what the hospitals are doing. Okay, so not going to read the entire table, but what I wanted to talk about next is a little bit about the costs. So estimates from the CDC, mortality programs, estimate that the average lifetime cost for any victim of a firearm injury is around $932,000. This includes both medical costs and wages lost over the lifetime of work. So this is for any aged firearm victim who has died in a violent death. Now, if we look to what we have in terms of the numbers for children between the ages of 13 and 19, and I don't have my reading glasses, but what we can see is that the average cost to treat every young person who comes into an emergency department is $11,000, and then for a fatal injury, so if they lived, it was $7,000, closer to $8,000, and if they died, it was about $5,800 per case. But that doesn't include the lifetime costs and the total costs. So of interest here is the total cost of firearm injuries to the hospital systems in the U.S. So these amount to roughly $108 million per year. Now, we can guess that these costs are being transferred back to taxpayers through Medicaid payments and billings. My time's up. Okay, we're almost done. I don't know how to stop it. Okay, so guess what? The good news is we're really moving along here. And what we can see here is if we consider also the loss of labor and the loss of wages over the life course, that the number becomes much more exaggerated, rightly so. What we find is that for violent firearm injuries and deaths, on average, the combined cost is about $454 million per year lost. That's a tremendous amount of money, and to wrap it up, I wanted to give you a couple of ways of thinking about the amount we're spending. All right, so the 2012 budget for OJJDP amounted to $70 million for core activities to support the JJDPA and the Juvenile Accountability Block Grants, things that could provide prevention funding. You can see, however, that we've spent $108 million, and that's a conservative estimate because it includes only hospitals on young people being treated for firearm injuries. So it amounts to basically, if we divide up these budgets per at-risk youth, we're spending about 2 cents a day on kids in the general population for prevention, whereas we're spending about $3.84 a day for hospital bills. So we're spending about $3 more a day on average per adolescent in the United States. And to put it in my suburban terms and understanding, basically, hospitals are buying the cup of Starbucks coffee, and OJJDP is putting the change in the cup. And that is not nearly enough money to do what we need to do to prevent these injuries and to make sure that we have a better future for these youth.